since our ACS IT was talking about this, overall what is happening, I will try to pitch in directly what exactly is happening in the health sector. Before that, I thank APCO on the digital prosperity for making me to come here, and also a lot of friends I could see. Shubha, we were able to link Suresh, Sharmila, everyone is here. Thank you. It's nice to meet you all again. Here, my discussion will be maybe for 5 to 10 minutes. One, I will try to be a little more bilingual, being happening in Chennai. Konja Tamil apapa, I will try to use it. And two aspects. See, what is happening in health sector in Tamil Nadu is one area which I will tell you. Then you can even say these are the potential areas where you can innovate whatever you want to do. See, the concept is unless you understand the health system, it will be very difficult for you to innovate or whatever entrepreneurship you do. So that is why you should understand. In fact, we should get into the health system to innovate. So the major things which we do it here is that one is your basically we'll start with our biometric attendance system. See, the common complication is that government officials are not coming in time, acting in time. See, for this we have a system where we have a face recognition biometric attendance system where we could be able to record all the attendance of the employees who are coming into the institution. Now we have expanded to the next level since we have a lot of field staffs. So GPS based location face recognition using your mobile. So this is one part of the face recognition attendance. The second, how it is happening in the office, which we call it as a file system, we made it totally transparent. We have an e-office where all the office procedures which was already there, we coded, and we could able to see who is working on what time, what is the turnaround time for disposing the files. See, this transparency will definitely bring the confidence in the system. This is two. Second, there are many program-based applications. So one is, all of you know, the non-communicable disease, hypertension, diabetes is the big challenge. We have a specific portal, Makkale Thedi Maruthuvam, where we reach the individuals to their house. In fact, we received a UN award in September. This is one of the 17 projects which are approved globally for the innovations it is done. So we could reach around 1.98 crore beneficiaries one-to-one so that we can track them, give them a screening, give them a tablet at home. So 1.98 crore beneficiaries we have. The tracking is one, which we call it as a Makkale Thedi Maruthuvam, where Sharmila is also doing a part of it. See, here the challenge is that it's a huge data. We need to track each and every one. We need to screen them on an annual basis so that we can prevent them with complications. The treatment is one part. We need to treat them correctly. We call it technically a control level. Then only we can prevent the complications. Complication, it includes your kidney diseases, heart attack, severe neurological problem, all those things we can prevent only if you are able to do it. So the challenge here is that one, the big data, huge population. The second is that whatever data the machine generates need to fit into the system. See, the human interface sometimes either intentionally or unintentionally makes error. See how we can connect this machine learning, which you are also piloting in Madurai. In a similar way, many things, if you are able to limit the human interface, definitely we can have a more achievement. This is one program. The second program is what we call it as a pregnancy cohort monitoring. See, in Tamil Nadu, we have more than 10 lakh mothers, antenatal mothers are being tracked for their high-risk conditions. See, the normal delivery, it's a normal process, it's a physiological process, but the complications tend to happen. See, who is that mother who is going to get the complications is what we are trying to do. So for that, there are selected high-risk conditions where every mother is identified, tracked, so that we can able to do what we call it as a birth planning. See, we can say that out of this 10 lakh mothers, this 5 lakhs most probably will have a complications. Better to admit them in a facility in advance where the facilities are available. See, otherwise what will happen? The mother will go to some place, the facility may not be suiting her requirements, then transfer. This is where the crucial hours are lost. See how we can tap using this platform we are doing it. In addition, we are giving around 18,000 rupees for every mother of Tamil Nadu, again for the maternal benefit or maternal assistant. This is also happening through a DBT, which our IT secretary is already highlighted. So this is tracking and beneficiary transfer, including the cash transfer. This is happening. Second is your big database of your birth and registrations. We are the authority for the birth and registration, which we do it through various multiple players are there. It could be a health inspector in your panchayat, or it could be a sanitary inspector in a corporation, or it could be a data holding for the registration department, or verification by revenue department. Multiple departments across, maybe we have not less than 16 to 18,000 registration units across. They use the single application. The data will be around, say around 9 to 10,000, 10 lakh births are happening, and almost 6 to 7 lakhs deaths are happening in the data. See, this data we communicate through an API with multiple other folders. That is what our secretary was talking about as a family database. So for election, we'll transfer this data, for a death certificate, for updating your ration card, so updating your school birth certificate, education. See, whatever data needs this is getting through an API. This is where we created a family database. Then finally, in the health sector, what we have two applications. One is your health management information system or the hospital management system. So this is two different purposes, and in this inbuilt, what you know, specific activity. It could be a pharmacy management, it could be a lab management, it could be a logistic management, or a simple bit spread which we use it in the hospital, how we can manage it. So this is the different aspects which we cover in HIMS or HMS. It's getting upgraded almost for 10 years we are using it. It's in the process of upgrading. And finally, if you want to put everything together, we need to have a common digital platform, which we call it as our National Health Data Mission. It's by the Government of India, where we are trying to register each and every provider, each and every facility, and each and every individual. See, if you are able to do this, the multiple pair can be used. Anyone can have an access to data with a concern, with the proper security. So in that way, there is no difference in whether you move between government or private or higher level or lower level. Your individual health record is accessible to you with your concern. You can share it to whoever you want. So the health facility registration, health personnel registration, and as an individual registration, which we call it as an Aadhaar ID, it's all part of your National Digital Health Mission. And these are the big things. But where you can pitch in is, so I usually see 2-3 areas. See, one is your straightaway commercial, where your things like your HIMS or HMS will help you. Wherever the user wanted, you can definitely customize them. You can give it. This is one area. The second area is your individual tracking. See, where now the lifestyle modification is the big intervention for your disease prevention. And most of the younger generations are more interested, where you need to maintain 2-3 things. How many hours you sleep, what do you eat, what is the quality, what is the calorie, and how much exercise you do. This lifestyle modification is very critical for your disease prevention or disease control. This is one area you can focus. And another area is more of a public, bigger orientation. See, I need to monitor the surveillance of the diseases. Which disease is happening where? I need to monitor the air quality. I need to monitor the water quality. See, this may not be interested to the individual or a small vendors, but unless and otherwise we monitor and we pinpoint where is the problem, which person is affected, we cannot have a big prevention strategy for the health sector. But here also, it is not that data is being collected. So we can implement a small equipment in this table. We can collect the air quality, put it in. See, there are so many ways in which data can be collected with the limited human interface. This is one area. Second, the climatic change and your vector. This is a big problem. This affects many of the challenges. See, for example, directly it will affect your reproduction, your milk production, your meat production, or even the human reproduction it will affect. The other area, it will affect the quality of the plant that's being grown. It in turn affects the quality of the food we eat. And there are ways in which the multiple vectors can grow. Sadharana Kosu Suluvo, there is a relation between these meteorological events and the mosquito breeding. See, unless otherwise you correlate, pick up where it is happening, it's very difficult to monitor. This is one area where you can consider. And yes, there are two challenges also there. See, the big problem with the government is this, it's very difficult to you all believe in one go. See, it takes long time to develop a relationship. And many times there are solutions are available, but whether it is cost effective or whether it is expandable, it's a big challenge. A simple thing called hemoglobin measurement, but everyone knows how to do it. There are many sensor-based equipments which we can, non-invasive, which we can measure the hemoglobin. But challenge is that I do this test at rupee 1 or 2. But when I come for the market, the minimum cost is 50. See, imagine my population, I need to cover around 7.5 crore population. Multiply by this number, it may not be economically viable for the government to adopt it. See, in the situation, we need a solution which is quicker, effective, sensitive, specificity. At the same time, the cost effective is very clear. See, otherwise, the solutions may not be an acceptable one. And another area is your teleconsultation, where our e-Sanjeevani program is there, where we can able to connect our lower level healthcare worker with the next PHC level or GHC, depend on the doctor consultation can be done, online prescription can be shared. Now, there is a scope for expanding into the different areas and you can even commercialize it. It is all possible to go to the next level or next area. And third area is your adherence. So, though it was started with TB, which Suresh was saying, so now even for the non-communicable disease, this become a bigger problem. See, particularly when the old age populations have started taking these drugs on a regular basis because of the dementia and other things which is already inbuilt, this is going to be a bigger problem. The adherence, how you can make them. See, otherwise availability is one issue, accessibility next level. This adherence is the one which prevents particularly the older generation from getting into the access. How we can do this. And finally, the geriatric population. It's really a growing population. There is a specific need for them. And it is not the mobile population. We need to have a targeted intervention which is based on the home. So, வீட்டுக்கு போய் கொடுத்தா மட்டும்தான் things will happen. See, otherwise, if you create an institution-based solution, it may not work. So, we need to have a way in which the services can be customized and delivered at the home. So, this is another area which we can do it. And finally, there is a lot of scores. In fact, personally, I used to say that the entrepreneurs are the real one who are going to develop the country. See, as an individual, you can get CEO, whatever it is. Only maybe your family or your close network can benefit it. But if you are a wealth creator as an innovator, definitely not only you, your family, the entire country will develop. See, the idea of the government is that we need to create a conducive situation for you to develop. Definitely, we are all there to support whatever you want. The idea is that it's not that you need to have a bigger idea, you're trying to sell it. You need to fit into the system. See, what system needs you need to identify and you can develop, innovate based on that. And second, the acceptance may not happen just like that. See, there will be a lot of challenges. See, you need to create a market for you. You need to create a user for you. But once you are able to do it, then things will be easier. At this level, what is the big challenge is that the way in which we can expand. So, how quickly you can expand. Either it's an area coverage or the size, whatever it is, this is another challenging area. And finally, as a user, for me, the big problem is that interoperability. See, if you have so many vertical programs, at one stage, it will be very difficult for an agency like government to use it. So, whatever way you innovate, it should be able to work with many other existing programs, either today or it won't happen in future. So with this, best wishes. Thank you once again for the opportunity. Thank you.